everybody. Thank you. Thank you for having me here. Thank you to the federal reps that came to this meeting, and thank you for asking us to share our plans. Thank you to CHIPS for asking us to come share our plans. Okay, so San Bernardino, just go forward. San Bernardino's plan for the EHE. Well, hold on, let me go back to what we currently do. Okay, so San Bernardino County, our Department of Public Health, we do try to cover, obviously, all those pillars through the different services, different departments, different sections of our department. We have our HIV prevention program, who does the rapid testing, the partner services, the linkage to care, the PrEP resources, PrEP navigation, and the provider education. Okay, so we do the provider education along with the pharmacy education on the non-prescription syringe sales as well. We have care, so our specialty clinics. Four of our health centers are federally qualified. 3 of them offer the specialty clinic, meaning that we do provide HIV-specific care in the community. Those 3 clinics offer the treatment. They work with the primary care providers for PrEP prescriptions. We offer the ADAP, the AIDS Drugs Assistance Program, and insurance assistance through those clinics. And most recently, we are bringing back our walk-in STD clinic, which to echo on that, yes, to echo on that, it's the STD, HIV is very important to collaborate those 2. Surveillance, we have our communicable disease section. They do the investigation, the partner services. More recently, they are doing a collaborative project called Inroads, where they will collaborate with the other different county departments, behavioral health, sheriffs, probation, even housing, and they actually will have a mobile team that will go out into the community in hardly reached areas, where focusing on the homeless encampments, where they will bring services, mental health services, medical care services, and other resources straight to where they're at. And then, of course, we have our Ryan White program, and they do a lot of the funding for our community HIV and AIDS servicing organizations, and they do the data care outreach as well. San Bernardino County Department of Public Health would like to create a more effective rapid response team, okay? And this team will have a mobile clinic. So because we already have the services, we do have services that are available, we can't sit around and wait for our patients or our clients or those people that need these services. We can't sit around and wait for them to come to us. Okay, we have to go to them. We have to bring the services to them. So this mobile clinic will be either using the existing MTUs through the Inroads programs, or currently our testing van through the prevention program, and we'll take the HIV care and the PrEP services to the communities out there. So it'll be an expansion of, not an expansion of Inroads, but an expansion of the HIV prevention program, but with a team that is more mobile, a team that can take the services out there, focusing on the underserved areas with transportation barriers. In this team, in this mobile clinic, essentially, we will be offering obviously the rapid testing, the rapid HIV, HCV, syphilis, and other STDs testing. We could possibly start the ART rapid start. Okay, that is something that is very important to get them onto the ART as quickly as possible, and perhaps even the PrEP starter packs. Okay, get them on PrEP services, prescription quicker. Confirmatory disclosures are something that we've had a concern with as well, because even though we do have the rapid testing service out there, when it comes to having them come back for that confirmatory disclosure, it can be hard. Once they leave that van, it's kind of hard to get them back to come back or to meet them somewhere. So having that van out there to have a safe space for them to come meet would allow for them to be more willing to come back and get that confirmatory disclosures. And then, of course, referrals to other supportive services if they're not already available on site. Through the rapid response team, we will have outreach done by peer educators, and these peer educators will be people who might already have a commonality with the community we're trying to reach. And in doing so, they will create some sort of trust, a trust between our agencies and the community. And then, of course, there'll always be collaboration with the Department of Public Health Communicable Disease Section, which is where the En-ROADS program is currently with, collaboration with Behavioral Health, Sheriff's Department, Probation, anybody that needs to, housing, ARMC, they have the ER expanded testing program as well. So that is our EHE proposed plan. And in doing this plan, we are hoping to address a few of the barriers, taking the clinic to where the clients are for the accessible rapid treatment and prevention services. Hopefully to those, going out to those growing pockets that Mario was talking about. We're hoping that, again, with these peer educators, they will have shared experiences that could create trust between the agency and the community. And then the collaboration with the En-ROADS and other community partners will complement this plan and then make it more effective. And then there's a little map of our county. Our county is pretty big. It expands at almost or over 20,000 square miles. And we do have about a population of almost 2.2 million people. And as you see in the picture, even though it's as huge as it is, our population is mostly dense and focused in that left corner, that left bottom corner. Okay, and even though it might seem that, okay, well, we might not have to reach too many, the little red city is San Bernardino City itself. A lot of the services are focused there. They're housed there. Most of them are housed there. But to get to the tip, to the bottom tip, it could be an hour and a half. And then get up to the high desert, it could be another hour. Okay, close to an hour. So it is a lot of driving distance between. And an hour might not seem like a lot for some of us, but for somebody who has a hardship, transportation hardship, that is a long time, and that is gas money, that is time, that is, so it can be a hardship. Our federally qualified health centers that do provide the specialty clinics, we do have 3 of them. One more centralized in the red area. There's one further down in what we call the West Valley, so closer to that bottom tip. And then we have one in the high desert. So in that, we at least try to offer different locations, spread out the locations to offer those services. Currently, San Bernardino County does have, as of 2018, in our data that has 4,563 people living with diagnosed HIV. Okay, 272 were newly diagnosed, with 73% being linked to care within 30 days. The viral suppression within 6 months is at 57%. Through this regional coordination, we are hoping for an opportunity to support and enhance the plan. We are hoping for knowledge sharing, a lot of knowledge sharing between the counties. Oh, I'm sorry, I'm supposed to stop. Especially regarding populations that cross the borders. Okay, because we are so close, or because we are touching borders, a lot of population goes back and forth. So a lot of knowledge sharing, resource sharing to provide the community individuals with linkage services of regional partners. So instead of someone coming to us or being diagnosed with us and then saying, well, I live out in LA, I don't just say, oh, here's a number, go ahead and call them. Okay, if I know that direct person, a direct number, someone who I can do a warm handoff to, that connection is going to be stronger, and that's going to be more effective in keeping them in care. Okay, so resource sharing between the counties. Some needed structures and resources that we could have help on is maybe like a regional campaign, and then advocacy for by community groups for evidence-based strategies not currently implemented in our county, such as the syringe services programs. Okay, that's it. Thank you.